would still have plenty of room in which to grow. In fact, it would grow exponentially. Keeping that from happening has been the primary goal throughout this journey. I said earlier that everything is relative, and so it is worth noting that despite all the sobering data I just shared, our experience in Oklahoma City actually stands out as better than the experience in most large cities and even here in Oklahoma. By breaking down deaths to how many deaths a community has experienced for every 100,000 residents, you can actually compare any city, state, or country, regardless of size. Across the totality of the pandemic, the United States of America has suffered 138 deaths per 100,000 residents from COVID-19. That's essentially the national average. In Oklahoma, the statewide number is 92, meaning that for every 100,000 residents of our state, 92 have died from COVID-19. Comparing to the national average, Oklahoma's statewide deaths are relatively better, and the state should rightfully be grateful for that. Having said that, we in Oklahoma City have done much better than the nation or the state. In the Oklahoma City metro, the number of people who have died per 100,000 residents is 73. Our deaths from COVID-19 are almost 50% below the national average and 20% lower than Oklahoma as a whole. And in fact, because Oklahoma City's numbers are so much better than the rest of Oklahoma, we actually bring Oklahoma's average down significantly. If you calculate the deaths per 100,000 and leave the Oklahoma City metro completely out of that equation, the state number is actually 100 deaths per 100,000 residents. And Oklahoma City's rate is comparatively lower by 27%. In real terms, all of that means that if Oklahoma City's average was the same as the rest of the state of Oklahoma, 329 more people would be dead in our OKC metro. If Oklahoma City's average was the same as the national average, 805 more people would be dead in our OKC metro. It is worth noting that Oklahoma City also compares favorably when measuring against our large peer cities around the country. Of the 37 cities over 500,000 in population, only 6 cities have had lower deaths per 100,000 than Oklahoma City. Those cities are Charlotte, Portland, Austin, Seattle, Columbus, and San Francisco. Every single other large American city has had more people die for every 100,000 residents than in Oklahoma City. None of this happens by accident. We had independent advice from our locally funded and locally appointed Oklahoma City County Health Department. That advice was based on public health and science. As a community, we acted upon that advice, we took precautions, and we didn't waste time. We have continued to meet the moment as best we can. And though we wish not a single resident had died, we have minimized our suffering compared to the United States, compared to the rest of this state, and compared to other large cities. The people of Oklahoma City did it right. And we'll always fight like our lives depend on it to preserve our local health department because our lives literally do depend on it. As I said earlier, everything is relative. Losing fewer people than we could have lost does not mean we lost no one. As I said earlier, our Oklahoma City metro has lost 895 residents to COVID-19. On behalf of the people of Oklahoma City, I send my deepest condolences to every family that has lost a loved one. Even when we express gratitude for relative success, we can never lose sight of what we have lost. I've certainly been faced with that prospect myself the last few weeks. My father, Stroud Holt, lives in southeast Oklahoma. He is 81 years old and spent 3 decades of his life teaching in the Putnam City School District here in Oklahoma City. We have kept our distance and did not see him on Thanksgiving or Christmas. In mid-January, he contracted the virus. His symptoms were significant, and we ultimately brought him to Oklahoma City, where he spent 11 days in ICU. His care was excellent. Our city's healthcare system has also been a major contributor to the relatively better preservation of life we have experienced in Oklahoma City. My father was at an OU facility, but his outstanding care could have come from any of our local providers. They are all fantastic. On Tuesday, he was released to our care. He is still physically weak, but his progress has been steady since entering ICU. We are very hopeful, but there were touch and go moments, and the experience has certainly been a reminder of the seriousness of this virus. And it has been a reminder that the arrival of the vaccine in December has still not fundamentally altered our situation as of yet. If you haven't had the vaccine, and most people haven't, you can still catch this virus, and you can still get sick, and you can still die. That's not going to change for several months. In the meantime, please continue to take precautions. Wear your mask, keep your distance, and wash your hands. And let's always remember our healthcare workers who have experienced a tough year, but an especially tough 3 months. The folks who helped my dad are heroes, and they've helped a lot of dads, a lot of moms, a lot of sons, a lot of daughters, a lot of sisters, a lot of brothers. We are so grateful. As we continue our precautions, we also continue the process of vaccinating our residents. Vaccination is ultimately the only thing that will really bring these numbers down, all the way down, and keep them there. But as you probably know, the doses have been slow to arrive. The Oklahoma City County Health Department has put every dose they receive in an arm within a week. Not a single dose in their care sits on a shelf or in a freezer. We just need more doses. Dr. McGough will talk more about vaccinations in a moment. In summary, cases and hospitalizations are coming down. The trends are good. But the numbers are still pretty high compared to where they were in the spring and summer. Overall, we've done a good job relative to the rest of the state and country, but every life lost is too many. Vaccinations are the answer, but that will take a few more months. In the meantime, we must continue to be careful. Don't catch this virus when the end is so close. Wear your mask, keep your distance, and wash your hands. Now I welcome our partner, Dr. Patrick McGough of the invaluable Oklahoma City County Health Department. He and his team are the finest in the nation, and they have literally saved hundreds of lives. Dr. McGough.
Thank you very much, Mayor Holt, for all of your ongoing support of local public health and for the mitigation of the spread of COVID-19 in such an amazing way from the very beginning. And good morning, Oklahoma County. Just want to point out that we are still in phase 2 of the state's vaccine plan and are steadily working to vaccinate the most vulnerable to COVID-19, our seniors who are 65 and older. We've made considerable progress. Oklahoma is currently in the top 10 in the nation in the distribution of vaccine. Right now, that's roughly balancing back and forth between number 7 and number 8. And here in Oklahoma County, we're proud to have played a significant role in helping our state reach that high ranking. In Oklahoma County, we've vaccinated 12.2% of our adult population, which includes healthcare workers, first responders, and individuals 65 and older. This is 1.1% higher than the state average of 11.1%. And among residents aged 65 years and older, the county has vaccinated 36.8% of this age group compared to 34% for the rest of the state. Oklahoma County accounts for more than 1 in 5, or 21.7% of the total vaccinations in the state. The county accounts for 19.1% of the total vaccines administered to residents aged 65 years and older. In just 8 weeks, we've vaccinated over 100,000 individuals here in Oklahoma County. That is a tremendous accomplishment and contributes to the impact Mayor Holt mentioned with new case counts beginning to fall, and even more importantly, our hospitalizations starting to decline finally. There is still so much more work to be done. It is our goal and desire and pleasure to vaccinate every person that wants a vaccine. We need the vaccine to be able to do so. Unfortunately, we continue to receive less vaccine than we are capable of administering. While Oklahoma County has approximately 21% of the population of the state, we're receiving an average of approximately 14 to 18% of the state's vaccine allotment. It is my understanding that the Oklahoma State Department of Health is currently working to remedy this situation, and for that I am very grateful. The demand is there, for which we are also very thankful. However, the supply is simply not. For those Oklahoma County residents who are still waiting on a vaccine, please know disseminating the vaccine as soon as we receive it. That is our goal, and that is what we've been accomplishing. So much so that we have begun pods, our points of distribution, literally awaiting to receive the vaccine to complete the day. We are excited to announce Oklahoma County hopes to be a future site of a megapod, which are large-scale pods being set up across the country. Through this pod, in partnership with the state of Oklahoma, the Oklahoma State Department of Health, and the National Guard, we'll have the capacity to vaccinate up to 6,000 individuals per day in our county. And this will be for 6 to 7 days a week. That is over 35,000 individuals receiving the vaccine each in our county each week. This will be in addition to other pods. We will keep you updated as plans are quickly developing for this megapod. Today in Oklahoma County, we're very proud to be able to, we're utilizing the strong partnerships we have with our area hospital systems to make the vaccine available in quadrants all across the community, in addition to the pod sites held at OCCHD locations and with other partners like Variety Care and CHCI. We've partnered with community organizations and other healthcare entities such as Restore OKC, Guiding Right, and Centennial Health to get the vaccine to underserved populations. We've strategically placed small pod sites at locations such as the Ebenezer Baptist Church and larger sites such as the National Cowboy and Western Heritage Museum to reach underserved communities in the neighborhoods where they live. We look forward to similar opportunities in quadrants across the county as vaccine supply increases. Undoubtedly, we could not have reached the 100,000 vaccination milestone here in Oklahoma County without the immense support of our hospital systems, Integris, Mercy, OU Health, and SSM. We are especially grateful to all the health systems, and particularly the nurses, physicians, support staff, and the volunteers who are the foundation of the vaccine dissemination process in Oklahoma County. Our community is resilient and answers the call when needs arise. We've heard from the faith communities, the business community, nonprofit organizations, educational systems, and many other sectors, all offering their spaces and their people to help in this vaccination effort. We thank each and every individual or group heeding the call to help. Please know we will begin bringing more partners into this effort as the number of vaccines we're allotted begins to increase. In the meantime, we want to thank the public. Thank you for taking the vaccine. While some communities across the nation struggle to get their vaccine out, we're proud that in Oklahoma County that our healthcare workers, first responders, and our senior citizens are doing their part to help get our community back to normal by taking the vaccine. We expect, as we continue to move through the phases, we'll see all our population make the same smart choice. We want to thank the public for being patient. In just a few short weeks, we will reach a very grim milestone. We've suffered through this pandemic for a year. Today, we reflect on the 599 lives lost here in our county and the lives forever changed as a result of this pandemic. We are, however, on the cusp of winning this battle. Finally, we want to thank the public for their continued adherence to the 3 W's. While we recognize hundreds of thousands in Oklahoma County are still patiently waiting on the vaccine, we are encouraged to see individuals still wearing masks, socially distancing, and washing their hands. You've heard me say it each time we're together. Without those mitigation tools, the impact of the virus would be significantly worse in our county. In closing, we've made progress with more than 100,000 now vaccinated. We're not back to normal just yet. Even if you've had the vaccine, you could still be an asymptomatic carrier of COVID-19. Having the vaccine provides you with protection similar to the flu vaccine. There is still a chance you could be exposed to the virus, and because you are vaccinated, you could have a very mild case of the virus, and if you exhibit any symptoms at all. Therefore, it's good for you to know that you could unknowingly transmit the virus to someone who has yet to receive the vaccine. For that reason, for the time being, it is critically important that we continue to mask up, watch our distance, and constantly wash our hands. Thank you, Oklahoma County, for your help as we get closer each day to defeating the virus. And now I would like to do something a little different than usual. I would like to run through some common questions and answers before we go to the media. One of our constant questions is, when will Walgreens and CVS begin offering vaccine to the public? Walmart pharmacies and some independent pharmacies will begin receiving vaccine directly from the feds, not part of our Oklahoma allotment, as early as next week. CVS and Walgreens will continue the long-term care project for now. Oklahoma has opted into the federal retail pharmacy program for COVID-19 vaccination. This program is a collaboration between the federal government, states, and 21 national pharmacy partners and independent pharmacy networks to provide COVID-19 vaccine to eligible individuals. The program will begin next week. At that time, Oklahomans will be able to schedule vaccine appointments directly with their local pharmacy. Please note that these appointments are scheduled via the pharmacy, not the vaccine scheduler portal. It is important to remember that appointment availability at your local pharmacy will be dependent on vaccine supply, and that appointments may not be immediately available. We also recognize that people are confused about second dosing. This varies across the state, but here in Oklahoma County, if you received specific instructions to schedule your second dose from the facility where you received your first, you should follow those instructions. If they gave you an appointment scheduling card, for example, you should follow the instructions on the card. If you did not receive instructions after your first dose appointment, you should re-register or register for your first time on the state's vaccine scheduler portal to get your second dose appointment. Why is Oklahoma County offering some vaccine clinics outside of the state's portal? The state portal continues to be confusing to many of our seniors. Additionally, our hospital systems need patient information prior to the individual arriving on site to get their vaccine. Currently, we're unable to pull client data directly from the state portal in the format our hospital systems need for their records. When will people under 65 with comorbidities have access to the vaccine, and how will the comorbidities need to be verified? Across Oklahoma, we continue to focus on the population most impacted severely by the virus, and that, as you know, is the 65 and older. As vaccine allotments increase, we will begin adding additional tiers to the effort. The next tier will be the 16 plus with comorbidities. The Oklahoma State Department of Health will be announcing soon how the comorbidities will be verified for individuals to make an appointment. And with that, I want to thank all of you again and say thanks to the media, and a special thanks to Mayor Holt, who honestly needs to be conferred with an honorary doctoral degree in epidemiology. And I also want to just declare him as one of my first and foremost public health heroes. With that, we will turn over to a time for questions from the media. Thank you.
All everyone. Thanks for being with us today. Just a quick note, we apologize for the sound difficulties. We will be posting a full transcript of Mayor Holt's speech on the OCCHD and City of Oklahoma City's social media accounts. Let's start with KOCO. Press *6 to unmute yourself. KOCO, go ahead and ask a question. Okay, Oklahoma City Free Press. *6 to unmute yourself.
Thank you so much. I'm so sorry. I had some audio issues myself here. On the next week when you were talking about the Walmart.
You cut out there, KOCO. Please repeat your question.
When you were talking about the Walmart rollout, can you speak a little bit more as to how that will go?
Thank you for that question. It's an excellent one, and I'm sorry I don't have more information about that. As I mentioned, that needs to be scheduled directly with the pharmacy that you contact, and that's outside of the city county health department process. And we will certainly post more about that process on our website and provide as much information as we can determine and learn about it to the public.
Thank you, KOCO. Anything else from your end? Okay, we'll turn it over to Brett with Oklahoma City Free Press. Brett, go ahead, *6 to unmute yourself.
No, thank you. There seems to be a delay.
Oklahoma City Free Press, if you have a question, please press *6 to unmute yourself. Okay, we'll go on to News 9. If you have a question, please press *6 to unmute yourself. Okay, if anyone else on the line has a question, please feel free to ask it now. Press *6.
Hi, can you guys hear me?
We can, go ahead.
Huh? Can you hear me?
We can hear you, go ahead. We can hear you, please proceed with your question.
Oh, can you guys talk more about the megapods? What needs to be done to bring in more megapods? And are you waiting for more vaccines until you can open them?
And I'm sorry, hopefully I heard your entire question. Excellent. What I did hear on the Megapod, yesterday was the very first time that I was involved in any meetings related to that, and it will be changing very quickly from day to day. But the goal is, under the White House administration, that they're designating that different states can request these megapods. We have requested them in our state, one at least for Oklahoma County, Oklahoma City. And it sounds very favorable that we will receive one. We're very excited about that. It will operate basically independently of anything else that's being done by the Oklahoma State Department of Health or the Oklahoma City County Health Department, but we will all be working together in a coordinated effort with that pod site. It will be basically self-contained and managed by the National Guard, is my understanding, and they will receive their own federal vaccine once it starts rolling in, and that will not be part of our state allotment. Thank you.
Okay, any other questions?
The host would like you to unmute your microphone. You can press *6 to unmute.
Any other questions from members of the media on the line today?
Thank you.
We'll give News 9 and Oklahoma City Free Press.
The host would like you to unmute your microphone. You can press star 6 to unmute.
Any other questions today, guys?
Can you hear me?
I can hear you.
Can you guys hear me on this?
Go ahead, proceed.
Can you hear me on this?
There's a huge delay, I think.
We can hear you.
There is a very large delay because I said that about 30 seconds ago. Can you please hear me on this?
There's a huge delay, I think.
We can hear you.
The delay is like 30 seconds on this, so if you end up hearing this, can you please have Mayor Holtz go over the data
There's a very large delay.
that he announced within the first 5 minutes or so?
Sure. I hate that there's a 30-second delay, so it's kind of hard for me to ask you what specifically you're interested in. But what I was talking about, I think there's two sets of data. Really, obviously, there's our current situation. And as I said, our hospitalizations and cases have come down about 40 to 45% over the last few weeks. Having said that, you know, our numbers are still relatively high compared to the previous episodes of the pandemic, because this November spike was just so unbelievably higher than all of the rest of our spikes that we've just never experienced anything like this. So it can feel good to have 420 people in the hospital instead of 700 people in the hospital, but that would have been a record high. 420 would have been a record high back in any other month before November. So the current situation is better than it was, but worse than it used to be. And so it's important to kind of put that into perspective and into context so that we don't have sort of irrational exuberance about the situation. We're glad that the numbers are going in the right direction, but they are still pretty high, and it's still a very serious situation. The other thing that I sort of talked about that you would maybe characterize as data sharing was more of a comparison between Oklahoma City and the state and the nation and other large cities across the entirety of the pandemic. And in terms of deaths, and this is maybe what you're asking about, in Oklahoma City, and this is how you compare differently sized cities and population centers around the country, is by breaking it down to how many deaths have you had per 100,000 residents. And by doing it that way, you can compare Oklahoma City and Los Angeles. You can compare Oklahoma City and the state of Oklahoma. You can compare Oklahoma City to the entire United States. It doesn't matter how many people there are once you break it down to 100,000 residents. So in our city, we've had 73 residents die per 100,000 residents. The state of Oklahoma has had an average of 92, but it's actually 100 if you take Oklahoma City out of that, because we're so much lower than the state in terms of deaths per 100,000 that we bring the state's average down by 8 people. So the rest of the state has had 100 people die per 100,000 residents from COVID-19. Oklahoma City Metro has had 73 die. The United States of America has had 138 people die per 100,000. So Oklahoma City is far below, almost 50% below the national average, and is 27% lower than the rest of the state of Oklahoma in terms of deaths from COVID-19. And then finally, I compared Oklahoma City to all large cities, all cities over 500,000, of which there are 37. And we have a lower rate than all but 6 of those cities. So the whole point really is we mourn every loss, and we've lost 895 of our residents, and that's 895 too many. But if you applied the same average of the state of Oklahoma or the United States of America or other large cities, we would have lost hundreds of residents more than we have. And so I think the point is that our local health department has given us great advice, and we have used it, and our situation compared to other cities and other states and places is better than it could have been. Yes? Okay, all right. Well, if you have any other questions, we're always